Hello, my name's Chris Shank, and I'm doing my article presentation on anorexia, and it's titled Dying to be Thin, Recognizing and Treating Anorexia in Adolescents. It's written by Eric Southard, Renee N. Bauer, Andreas M. Kumaro, and I got it from Women's Healthcare magazine, August 2015. And I actually got it from researching through the Wolfgang Library through Widener University. Um, this article was mainly focuses on the identification, assessment, and management of anorexia in adolescent girls because they are the most vulnerable to this disorder. And the nurse practitioners, um, as you can see looking at the letters beside the authors, they are all in the healthcare field, and they are the first line of defense, and they do a lot to help formulate treatment plans for these people that suffer from anorexia. Unfortunately, we're looking at 30 to 50% actually relapse after inpatient care within 2 years upon release. So we're looking at a lot of work being done with these adolescents, and it's not always as effective as it could be. Some of the things that are very important ways to identify anorexia, other than just looking at someone and seeing that they're very thin, is asking these screening questions. This is from the eating disorder examination that was listed in the article, and I'm just going to read the questions to you. For example, do you make yourself sick because you feel uncomfortably full? Do you worry you have lost control over how much you eat? Have you recently lost 15 pounds or more in a 3-month period? And do you believe yourself to be fat when others say you're too thin? And would you say that food dominates your life? And the telltale sign is if one responds with 2 or more yeses, then it can indicate an eating disorder that may be present within this person. Moving on to the next slide. There are some diagnostic tests for anorexia. Just like any disorder or mental health condition or medical condition, early detection is the key. The longer someone has this disorder, the less likely they are going to be able to recover from it due to the damage that is done. Their height, weight, and BMI, body mass index, needs to be monitored on a regular basis. Some blood tests that need to be done or lab tests include the electrolyte balance, looking at liver functions, urinalysis, their hormone levels should be done, all as a part of their initial workup, and they should be done on a regular basis. An electrocardiogram and echocardiogram needs also to be done to determine arrhythmias, which is the issues with the heart. And unfortunately, this is the most common death in patients with anorexia. So it's very important to monitor their heart functions. 3% of the girls, 13 through 18, have some form of eating disorder, which could be anorexia, bulimia, or binge eating disorder. And females with eating disorders are more likely to attempt suicide versus those with other psychiatric disorders. So this is a heavy hitter, and we need to be aware of what's going on with these young girls. Some differential diagnosis or coexisting mental health conditions along with anorexia can include major depression, which we've learned about through this course, anxiety disorders, sometimes trauma or past trauma can be involved as well with anorexia, and sexual abuse as well. So it is based on that suicide risk, it is so important to monitor their thoughts for self-harm. Some other treatments for anorexia that include some medications. Pharmacology, there actually are no FDA-approved drugs for anorexia at this point. But there are the SSRIs, the selective serotonin reuptake inhibitors, that can be used once their weight is managed. And that is to really help reduce those symptoms of OCD and some of the other diagnoses that I talked about in the previous slide. They do have some controlled trials for some other medications, but right now they don't have the results for these medications at this time. And then if there are antipsychotics that are being prescribed, unfortunately many of these adolescents that suffer from anorexia won't take them because they are well aware of the possible side effect of weight gain, which is unfortunate. Some treatment, continued treatment that I'm sure was mentioned previously in our presentation, but I just want to cover some of the others that were mentioned, or some of the ones that were mentioned in this article. CBT, gold standard cognitive behavioral therapy, is used to help change the unhealthy body image, and that does take time. There's also family-based therapy, which is intensive outpatient, but it also involves the family. So a lot of education is provided to the parents and whoever is there to support the person in the home, and it can be superior to regular patient care, and it's as effective as systemic family therapy, but at a lower cost. Hospitalization, unfortunately, is needed if the weight goes below 75% of the person's ideal body weight, or if there's an extreme electrolyte imbalance. So it's very important to monitor that. And the psychiatric inpatient care that is determined to be needed if the adolescent is in a crisis state. That's why the suicide assessment is so important. And as we all know, the length of stay in facilities depends upon the need. It could be, 3 to 10 days, or 2 weeks, or up to 30 days, or even longer, depending on the need. So just to kind of conclude, this was an article that was pretty much written by nurses or family practitioners, and they want to make sure that that people are aware that these nurses and healthcare providers are the first line of defense and are very crucial in treating our girls with anorexia. So along with the treatment plan, the team of healthcare providers that consists of the psychiatric and primary care provider, along with the dietitian, a licensed master's or doctorate level therapist, psychologist, and a registered nurse. So all of those people work together. They must not only treat the eating disorder, but they also need to treat any coexisting issues such as the mental health, the depression, anxiety, possible substance abuse, and trauma. All of those things need to be addressed in order for these people to get help and be successful. Like I said, nurse practitioners play an integral part in keeping these patients engaged. It's pretty much the message of this article, and which can ultimately save their lives if they can keep them in treatment and get them through to recovery. Some treatment may include medications that I mentioned. They can help alleviate signs and symptoms, and I mentioned CBT or FBT is used as regular screenings and medical tests to determine appropriate level of care based on their progress and weight gain. Here are some useful resources that were listed in the article. These are all national-based websites, and I looked at a few. There's NAMI's in there, Rosewood Branch, and the other ones are based off of eating disorders. And there's my reference. Hope you enjoyed the presentation. The article was a very interesting read, and I believe this disorder is very debilitating. I've worked with a couple of students in the past with this disorder, and it's a struggle. One girl just recently got released from the hospital, and she just returned to my school program, and she's looking pretty good. So I'm rooting for her. So thanks for the listening, and I hope you enjoyed the presentation.